Doctors, I want to thank you for taking just a moment to watch this short presentation on motor vehicle collisions and the pediatric patient and some of the physics that they experience in a motor vehicle collision and some injuries that they can receive that we may not see. They are oftentimes underdiagnosed or missed on initial diagnosis. Just to let you know who I am, I'm Dr. Shetlin, and I am a certified auto accident occupant injury specialist. You can kind of look through the other list of stuff, or if you have any questions from my background, I'd be happy to go over that with you. Today I just want to cover briefly the mechanism of injury, the research for pediatric and adult patients, and then focus on the pediatric research and some of the protocols that we need to know in diagnosing and treating the pediatric patient post-motor vehicle collision. Just briefly, statistically speaking, there are over 1.5 million motor vehicle collisions per year, resulting in 3 million whiplashes that are recorded, and that's usually dealing with adults, not typically with kids. Out of all the personal injury cases, 50% end up having long-term problems and 10% are disabled. Again, these statistics are basically showing adults, not even addressing children, which we will use some other research for that in just a moment. National motor vehicle crashes are the leading cause of deaths for teenagers, so that's an important thing to note, that teenagers are also injured or killed in these accidents quite frequently. Now, I just want to show some brief footage. This is research footage taken from the San Diego Spinal Research Institute and the Croft research, where we actually look at occupants who volunteered to be in crash tests where we could measure the physics applied to the human body, not crash test dummies. Primarily these are in low-speed collisions. Here we see the closing velocity of what we would call the bullet vehicle, the vehicle that's coming in and striking the target vehicle, which is a vehicle, for example, that would be stopped at a stop sign. The closing velocity is 9.9 miles an hour. That is classified as a low-speed collision. Anything under 10 miles an hour is considered a low-speed collision. The delta V represents the change of velocity that the target vehicle is going to experience. It's going to go from 0 to 6 miles an hour instantly. And some of the research I'll show in just a minute shows how a change of velocity of 5 miles an hour or 5 Gs can actually cause injury. 8 miles an hour or 8 Gs guaranteed. And I don't want to confuse miles per hour with Gs. They are typically quite different. Here we see a head acceleration this person's going to experience is 13 G forces. So as we watch this individual, which is an adult, we don't have studies for children because we just can't get kids into car accident studies, because who would want to put their kid into a study like that? But here we have an adult that volunteered to have this red car crash into him. This is the second impact in the study, actually, where this large black sedan was struck by the small Honda. Here we notice the head restraints in a low position. That's a complicating factor, acting as a fulcrum where his head hyperextends over that as his vehicle lurches forward at a change of velocity of 6 miles per hour. Second impact, and yet there's no visible damage to his car. As you can see here on the rear bumper, as a $50 bumper clip broken on the bullet vehicle. And he was actually injured and taken out of the study. Now if we look at a kid in a car seat and with their 3 or 5 point harness and the size of this gentleman's head to his body size, plus he has muscle tonus that he's built, muscle strength in his neck over the years of his life, versus a head that's a third or a fifth of the size of the body with next to no muscle tonus, because children just don't have those muscle tone strength at this age. There's a lot of potential for some soft tissue injury here, which is why we build these car seats and try to make these kids as safe as we can. However, there are some concerns to look at. In the interest of time, I won't show the first video, but just to show this second video, there's a big push to make sure that children stay rear-facing for up to 2 years, which is great in a frontal impact. The majority of collisions and injuries that are going in and getting physical therapy are typically rear impact collisions. So we've got to really look at the dynamics involved. Here we see a frontal and a rear at the same time. Now with a frontal impact and front seated, you can see that does a lot of force. But the same thing is going to happen in a rear impact collision with a rear facing seat. That's very important for us to note. So children that are rear facing and are involved in rear impact collisions, there's quite a bit of potential risk of injury. If you picture this as a rear facing and they're rear ended. Now these injuries that we can sustain in the discs and joints, and there's a lot of anatomy, physiology differences in a child versus an adult that we'll look at in just a moment, but these are considered very serious and they lead to degenerative changes. Even when children receive these injuries, it starts the degenerative process right away. So the child may not elicit the symptoms like an adult would, which we'll talk about the reasons why in just a moment, but that doesn't mean they're not injured, and it can catch up with them later. These are, according to the AMA guidelines, permanent injuries when we have soft tissue injuries such as ligament instability, facet joint capsule injury or disc injuries. Now looking at this picture, we've got a picture of a spine with anterior longitudinal ligaments and musculature, interspinous musculature, and the actual bones themselves. On a hyperextension like the gentleman that was injured and taken out of the study, there could be anterior soft tissue injury. Then the flex forward, the seatbelt engages, the head keeps going, and there can be tearing of interspinous or posterior longitudinal ligament injuries. This is really important and often overlooked in the radiology portion. Now with kids, we're typically not taking as many x-rays, especially if they're not eliciting symptoms. But when we have a loss of curve, it's usually due to an injury, like a whiplash or a football whiplash or injury. It's important stuff to look at because over years it starts to develop into degenerative arthritis. Arthritis is not part of growing old. It is dysfunction in a joint over time. So if we have trauma or dysfunction in a joint, as the years creep by, it's going to cause problems. When we look at the research related to this, Punjabi found they used 6 cadaver spines in their tests, and each spine was set up so that the head was rotated to the left, and then they subjected them to impacts 3.5 miles an hour, 5 Gs, 5 Gs, 6.5 Gs, and 8 Gs. And what they found was that at 8 Gs, pretty much everybody got injured. There were tears or injuries there. Female drivers were 3 times more likely to be injured than male drivers in whiplash crashes. A significant percentage of chronic pain reported by women could be attributed to motor vehicle collisions, and male and female subjects were matched with very little difference between them other than the muscle mass in the neck. And since men's necks were about 15% larger, they found them to be about 31% stronger in flexion extension, which they just got more muscle to help protect ligaments, and thus the women were more likely to be injured. So when we start comparing this with pediatrics, according to the Pediatric Spinal Journal, the most common cause of serious pediatric spinal trauma is motor traffic incidents. The 0 to 4 year age group has the highest proportion of serious injuries at 47% of the group. Now this is where it gets important. Children who sustain minor injuries and are not brought to the hospital but rather see a general practitioner, pediatrician, or other healthcare professional are not included in the sample data. Therefore, this data underrepresents minor injuries. So it's important for smaller kids to still get checked by a certified auto accident occupant specialist. Now that means that someone who specializes in this should be working with their pediatrician, with the ER doctors, to help double check for the soft tissue injuries and hopefully do some rehab. Which with kids that are younger, the rehab, I mean, there's chiropractic, there's some infant massage, physical therapy is difficult to do on the infants and little kids, but the chiropractic and infant massage is pretty easy to do, and they seem to respond very well to it. The best comparative research to auto accident spinal injuries for kids is comparing research to shaken baby syndrome. It's interesting when you look at the data that's out there according to the Pediatric Spinal Injury Type and Severity study that came out, comparing that to the review of shaken baby syndrome. Of the total number of spinal injury cases found in these studies, 30% were classified as serious, 70% were classified as minor. You look at the shaken baby one, the mortality, which I would think is serious, 30%, 70% of survivors suffered long-term impairment. So maybe minor, but a long-term challenge because of that. Shaken baby syndrome obviously is a whiplash type injury. They even use the same terminology, whiplash or cervical acceleration deceleration injury, only it's intentional versus accidental like in a motor vehicle collision. They really point out clear in the research that the anatomical features make a huge difference, and the head is large as compared to the body size, and there's weak or immature neck musculature. This is really important for us to recognize with these kids and infants. This is another huge thing. As the child is developing, when we go from embryology to infant to preteens, teens, and adults, the vertebral body, as it's growing, the disc space is actually shrinking percentage-wise. So there's less space for swelling before a disc or a facet joint is going to impede or impinge on a nerve. In a child, there's so much extra space in there, they might not feel pain because there's so much extra room for swelling before a nerve is actually impeded when we look at the anatomical structure of these infants. But that doesn't mean the soft tissues were injured or shouldn't be rehabbed slightly or partially. Children will respond much quicker, but there should be some care in those infant years so that they don't have a long-term problem. Delay or faulty treatment leads to the adhesions about the facets and scarring about the capsular ligaments. This is again from Pediatric Spinal Injury Types and Severity from 2007. So it's very important that whether or not these infants or young children are showing or eliciting serious symptoms, some of them are small, like their parents will notice they're not sleeping as well, or they're not latching on nursing as well, or they're just a little more cranky. They may not be going, "Oh, mom, dad, my neck hurts." They might not be saying these kind of things, or "My back hurts." But it's important for us to still recognize and do early intervention to prevent long-term problems. This is just a quick study of actual teenagers, three different gals. One had an accident 1 year prior, and you can see the curve where the curve in the neck should be and how straight her neck is. This is important. This one should have a C curve going this way, and you can see her curves going the opposite direction. It's 5 years post motor vehicle collision. And this one, it's 10 years post motor vehicle collision, and the neck is curving the wrong direction, and there's arthritic change growing in the spine, osteoarthritis, which shouldn't be happening when these girls, all three of them, three different gals, are the same age but different cases, and they're all only 25 years old. So at 15 years old, this gal was in a car accident, whether she was a driver, just getting her driver's license, or she was a passenger. Either way, she thought, "Oh, I'm young, I'm fine, it'll heal up." All three of these girls were very busy with school and postponed their care, and it leads to a degenerative problem. Our brain controls the entire body and communicates with the body through the spinal cord, which is housed in the spine. If we have spinal degeneration, it is going to affect our health and longevity. And studies have shown that when soft tissue injuries occur, or a reverse curve is present in the spine, particularly the neck, that it degenerates 6 times faster than what would be expected. So the key points to sum up with, and I again appreciate you taking the time to just listen to this brief thing. According to pediatric trauma research, the most common accidental cause of serious pediatric spinal trauma is motor vehicle traffic incidents. And traffic-related incidents account for approximately 1/3 of all the spinal traumas and half of serious injuries. According to the review of shaken baby syndrome, it's a non-accident version of whiplash. The mortality and morbidity rates are fairly similar to that of car accidents, though car accidents rank a little higher. And it's a very similar type of injury, so it's a very comparative study base that we can look at for these injuries with kids. The larger head-to-body ratio combined with the immature or weak neck musculature for infants and children are a greater likelihood of injury. Rapid shearing forces are hazardous to the neck muscles and ligaments and the dura mater and brain tissue. We just are not designed to handle much shear force. Abrupt deceleration with impact increases chances of injury. So there's quite a few things here to look at. I just want to emphasize that it is important to have these kids checked by a certified auto accident specialist. Work with them. There are chiropractors, several of them who are certified. Well, when I say several, there's about 20 in the state of Utah. And they're easy to work with. I mean, there's only a handful of MDs or DOs that are certified in this at this point. But we all have our specialty, and chiropractors do as well. And just because you send to one chiropractor doesn't mean they're a certified auto accident specialist. And just because one says they're an accident specialist doesn't mean that they're certified. Chiropractors have their specialty just like medical doctors do. So find a good auto accident specialist that you can team up and work with. And let's just help these infants and children rehab properly so they have a better, healthier, more productive youth and adulthood. Thank you.